Hi folks, and welcome back to part 2, looking at 8 training recommendations for the application of blood flow restriction. Training recommendation 1, frequency. BFR training can be performed chronically, 2 to 3 times per week, in combination with your high-low training. High-low training in this case is considered above 70% of your 1 repetition maximum. Or when high-low training is not being carried out, for example during a deload week, blood flow restriction training can be performed 1 to 2 times per day. This frequency level can be used to shock the musculoskeletal system for a short period of time, for example less than 3 weeks. Despite the low load nature of BFR, 1 to 2 times per day is very stressful and will likely require 10 days of recovery to see any benefits. Training recommendation 2, percentage of limb occlusion pressure, LOP. To remind ourselves, LOP is the minimum pressure needed to completely restrict both arterial and venous flow to the limb, and exercise is performed at a percentage of this value. A recommended percentage of LOP in the arms is between 40 and 50%, and in the legs between 60 and 80%. Moving on to training recommendation 3, exercise selection. Both single joint and multi-joint exercises have been shown to increase hypertrophy, but single joint exercises are likely superior to drive growth to muscles distal to the cuff due to higher local fatigue tolerance. Training recommendation 4, repetition scheme. Completing 4 sets, which involves performing 30 reps on the first set, followed by 3 sets of 15 repetitions, or failure training for multi-sets, have both been shown to have efficacy. But as expected, failure training tends to increase recovery time. However, for those of you who have an advanced resistance training age, failure may be needed to maximally fatigue targeted muscle groups. Training recommendation 5, wear time. From a safety perspective, between 10 to 20 minutes is ideal. When it comes to looking at the type of application of BFR, continuous application, which describes when the BFR cuff is left inflated throughout the duration of the exercise versus deflated during the rest periods, shows superior metabolic stress and muscle fatigue despite similar levels of perceptual effort during exercise. It should be noted when BFR is removed or not applied during the rest periods, tissue oxygen levels tend to recover, reducing the metabolic stress. It is recommended, however, to deflate the cuff after every 1 to 2 exercises and wait at least 1 minute before re-inflating. Moving on to training recommendation 6, loads. When using BFR, a load of 20 to 50% of your 1 repetition maximum is recommended. This is because loads greater than 50% of your 1 repetition max do not seem to augment the benefits of BFR exercise, and loads less than 20% of your 1 RM provide suboptimal outcomes in terms of hypertrophy. In terms of when to implement BFR during a session, it is recommended to implement BFR after high-low training, unless no high-low training has been performed, for example during deload weeks. This is because maximizing hypertrophy requires a combination of high mechanical and high metabolic stress, which could be sacrificed over the long term if BFR is performed before heavy load training, due to the acute fatigue response that occurs from BFR exercise. Training recommendation 7, tempo. Lifting tempo should be between 1 and 2 seconds for the concentric/eccentric phases of exercise. and this is because most BFR research have used these numbers. On to training recommendation 8, INTERSET rest. 30 to 60 seconds rest in between sets is recommended. It should be noted these short rest periods provide a greater degree of metabolic stress compared to longer rest periods, e.g. 150 seconds. And that concludes the 8 training recommendations for using BFR. We're now quickly going to look at how to progress BFR in your resistance training. To make BFR easier, you can use short lever exercises, partial range of motion, sets to non-failure, decrease pressure, or decrease the load. Whereas, if you want to make things harder, you can use long lever exercises, full range of motion, sets to failure, increase pressure, or you can increase the load. Hope you found that useful, folks. This presentation was brought to you by Talking Sports Science. Thanks for listening. See you next time.